Good morning. First of all, thank you for the opportunity of being here today to share with you our intervention model and tools developed to support Portuguese pharmacists in the provision of immunization service. In my presentation, I will speak about our nationwide pharmacy-based HPV immunization campaign developed in 2009 and the obtained results. In 2007, the Portuguese legislation allowed pharmacies to expand the scope of their activity onto new areas such as immunization. Pharmacies can only administrate vaccines that are not included in the national immunization program, such as flu vaccine and HPV vaccine. Subsequently, the National Association of Pharmacies developed training program, an intervention model and recommendations to support pharmacies and pharmacists in the provision of this new service. AMF provided a list of materials that pharmacies should have in order to treat an anaphylactic event, a list of nurses for interested pharmacies, and massive training program for pharmacists all over the country in a short period of time. We offered pharmacists a choice between hiring a nurse or having training themselves. The main goal was to prepare pharmacies for the first nationwide pharmacy-based immunization campaign during flu season 2008 and 2009. It is important to say that in this first flu immunization campaign, at least 159,700 patients were immunized against influenza through the entire flu season. It was estimated that nearly a quarter of all influenza vaccines dispensed in Portugal during the entire flu season were administered in pharmacies. The training model was based on the American Pharmacist Association Certificate Training Program for Pharmacists, which quality and contents have been recognized by CDC's National Immunization Program in 1998. Before the definition of our intervention and training model, the AMF service manager for this area became certified by HAFA in March 2008. The main contents of our training addressed 4 key areas: vaccines, not included in the National Vaccination Program, pharmacy-based immunization service, anaphylaxis, and vaccine administration technique skills. Pharmacists providing this service also received training in basic cardio life support. I would like to give some key data on HPV-related cancer and HPV vaccines in Portugal. Portugal has a population of 4.64 million women ages 15 years and older who are at risk of developing cervical cancer. Current estimates indicate that every year 949 women are diagnosed with cervical cancer and 346 die from the disease. Cervical cancer ranks as the 4th most frequent cancer among women in Portugal. Data is not yet available on the HPV burden in general population of Portugal. However, in Southern Europe, the region Portugal belongs to, about 9.2% of women in the general population are estimated to harbor cervical HPV infection at a given time. Both quadrivalent and bivalent HPV vaccines are marketed in Portugal. HPV vaccine was included in the National Immunization Program for target population in 2008. Females age 13 were chosen as target population for routine vaccination. A catch-up campaign for females age 17 was also available from 2009 to 2011. For target population, immunization is provided free of charge on demand through regional health centers across the country. HPV vaccines can also be dispensed at pharmacy and administered in community pharmacies to individuals not included in Portuguese immunization program. According to the Venice survey, the coverage for routine vaccination with 3 doses in Portugal was 81% in 2009. For the catch-up vaccination campaign, the vaccination coverage was 56% in 2009. After the success of the first nationwide flu immunization campaign, the National Association of Pharmacists decided to develop a second nationwide campaign now in the field of human papillomavirus immunization, the pharmacy-based HPV immunization campaign. We developed a model and tools to support pharmacist intervention in the campaign in collaboration with two medical societies. The campaign was launched in 2009 and was preceded by evening conferences for pharmacists held in 3 major cities. These conferences had the participation of gynecologists and pharmacists as speakers. All pharmacies were invited to participate in this campaign, and pharmacists were requested to target the intervention to female aged 13 through 26 years. The campaign main objectives were to inform target population about HPV and the benefits of immunization and to raise public awareness of this new service in community pharmacies. The overall aim of the campaign was to contribute to the prevention of HPV infection as a tool to the battle against cervical cancer in Portugal. Although the information campaign was targeted to female aged 13 through 26 years, the vaccine administration was targeted to young women with prescribed HPV vaccine aged 18 through 26 years, the age group not included in the national immunization schedule. Concerning females aged 13 through 26 years without prescription, pharmacists informed patients about HPV infection, preventive measures, and the benefits of immunization. A referral to the national immunization schedule or to the prescriber for HPV vaccine prescription was performed according to the age of the female. In case of young women aged 18 through 26 years, with the HPV vaccine prescription, pharmacists dispensed the vaccine, suggested immunization at the pharmacy, delivered immunization, and recorded immunization provided. The tools and materials developed by NF to support pharmacies and pharmacist intervention included a leaflet about HPV infection and cervical cancer, a card for the patient to register immunization data, a booklet guides for pharmacists, a pharmacist intervention protocol in case of an anaphylactic event, and a poster to promote the service in the pharmacy. A cross-sectional evaluation was performed based on the data recorded in the spreadsheet used by pharmacists to document the service provided at the pharmacy. All community pharmacists were invited to participate in this campaign. The evaluation was performed for 3 months. Approximately 32% of Portuguese pharmacies participate in this campaign, and of these, 4.6% sent duplicates of their records to ANF. 97 of pharmacy-based immunizations were performed by pharmacists. The other 3% were performed by nurses. In fact, some pharmacy owners decided to contract nurses to administrate vaccines in their pharmacies. At least 113 patients were immunized in 39 pharmacies based on data received. All of the patients were female and 65% were aged 19 through 26 years. Average age was 24.9. 29% of HPV vaccines were administered in pharmacies. No record of anaphylaxis ever occurred in pharmacies. Compared with other immunization campaigns, a few pharmacies have sent data to ANF. Financial constraints could be the main obstacle for patients not included in the national immunization schedule to get immunized in pharmacies or other settings. Community pharmacists are well positioned to inform target population about HPV infection and cervical cancer and the benefits of immunization. To immunized patients with an HPV vaccine prescription, as well as reinforcing adherence to the vaccine 3-dose series, contributing thus for optimizing immunization rates. During the campaign, CEFAR, the Center for Health Research and Evaluation from ANF, performed a research study concerning the pattern of use of HPV vaccine and adherence to vaccination schedule among individuals not included in Portuguese immunization program. Objectives of the study were to identify and characterize the HPV vaccine use profile, the adverse events resulting from the administration, the possible sites of vaccine administration, and to assess the adherence to vaccination schedule. All Portuguese community pharmacies were invited, and a cross-sectional study was undertaken in which pharmacies invited all users of HPV vaccine. Data was collected between June 2009 and February 2010. Subjects who agreed to participate in follow-up evaluation were contacted by telephone by CFR. 5.2% of pharmacies participated in this study. 309 participants completed self-administered questionnaire, and of these, 209 individuals completed follow-up evaluation. 196 of study participants had completed 3-dose series. 3/4 of respondents adhered to the recommended vaccination schedule. The majority of those not adhering to the dosing intervals failed with the 3rd dose. 1/3 of the study participants reported at least one adverse event, of which 70% were at the injection area. About half of HPV vaccine doses were administered in health centers and 1/3 in pharmacies, data similar with the HPV immunization campaign. 90% of the HPV vaccine users had completed the 3-dose regimen, always in the same place. All participants were women, median age 22 years old, and 52% had completed university degree. Adherence to intervals and completion of HPV vaccine 3-dose series were high, as you can see. 1/3 of participants reported at least one adverse event, of which 70% were in the injection area, as I said before. About half of HPV vaccine doses were administered in health centers and 32% in pharmacies. So, the role of community pharmacists, we can play a significant role in immunization. Pharmacists can raise awareness on immunization, identify high-risk individuals and refer them to the doctor or to the national vaccination programs. And also, we can dispense and administer vaccines to these two patients who decided to choose the pharmacy as an immunization setting. Pharmacies represent a valuable healthcare chain close to the population and offer many advantages as places to administer immunization, namely easy access, geographical distribution, and convenience. Community pharmacies are in a unique position to improve vaccination rates and reduce the burden of vaccine-preventable diseases on the population. Finally, we acknowledge all pharmacies and pharmacies to send data to ANF, which enabled the evaluation of this campaign and the study. We also acknowledge Portuguese medical societies for revising tools developed to support intervention. And thank you for your attention.